I'm Dr. James Perkins, the Clinical Director of Alternative Health Solutions in West Bloomfield, Michigan. And we're going to show you a little bit of testing today, typical office examination for physical medicine purposes. Our subject is Chris, and Chris has some problems with his low back, he's telling me, and possibly his upper back, some tight muscles in his legs, things like that. He's used massage therapy as recent as yesterday, and so this is perfect for him to be here. So we're going to do some examination and try to find out what this low back problem is. Oftentimes when patients come in fact, almost every time, the first thing I do is a visual inspection. It's good to see if the shoulders are high on one side or the other, if there's a head tilt, or forward head posture, or some type of antalgic lean, and always check that first. The second thing we always do is some range of motion tests. So let's go ahead and do a little range of motion test here. So this would be the beginning of a physical examination, and we'll just see what we have. So I'm doing a visual inspection from the back here, just looking at shoulder height and his head to see if there's any head tilt or rotation. And as you can see from the side view, he's got very nice posture. So what we're going to do is ask Chris, would you bend forward please, and just let your arms hang, and just go down as far as you can go. Do you have any pain doing this?
No, just tight.
Okay.
Yeah, just a little tight.
Come back toward me lean back toward me this way. What happens on this range of motion when you lean back? Do you have pain in your low back?
No.
Okay.
A little bit of discomfort in the middle.
Okay. How about if we laterally tilt and just lean? What happens on leaning? Do you have any stiffness or pain?
A little stiff.
Stiff? No real pain?
No.
Okay, good. So far things are good. His ranges of motion look pretty good. Wrap your arms right around you. Twist your body as far as you can twist to one side and to the other side. What happens on rotation? Do you have any pain on rotation?
No.
Okay, relax down. Good, I like that. Turn your head to this side and to the other side. So he likes to laterally tilt. Now look straight forward and just rotate your head to this side. And rotate it to the other side. How about on rotation? Do you have any pain in your neck?
Mm-mm.
Okay, so now let's use a little muscle testing technique. Hold your arms up. It's impossible for anyone to hold their arms up with their thumbs back if they have a disc problem anywhere in their spine or jaw. So let's rule out a disc. Good. Drop your arms down here. I like that. Now, if you could lie on your back on this table. Oops. I'm out of camera range, sorry. Lift your head up. Okay. So, he's got low back pain, and in weight bearing, when he was standing, he really didn't have a lot of problems. He had good ranges of motion. We kind of ruled out the fact that there might be some compression problem in his back. He was against gravitational forces, so he was compressed to a certain extent. Now he's lying down. There's no compression on his body at all, and he's totally away from gravity. So now let's see what happens when he gets away from gravity. We'll see some things here. Bring your knee up, bend it. What happens when we push your leg up? Any pain doing this?
A little stiff, but no pain.
Mm-hmm. And what if we bring the knee in? This is called external and internal rotation of the hip.
It's fine.
Okay, you might want to look at the video we did on primary and secondary restrictions, YouTube, for physical medicine, and that will give you an idea of what's going through my mind right now. Primary areas of restriction are the feet and ankles, the pelvis, the visceral organs, the cervical spine, cranial vault, and other than that, everything else is secondary. So when he has low back pain, is the lumbar spine a primary area of restriction? Generally not. This is kind of thought to be primary by most physicians. I find clinically that if you have a lot of low back pain, you better look around because the pelvis is a primary area of restriction, and that's kind of where I'm going now because he has low back pain and some mid back pain. Those areas are generally secondary. So I want to make sure I'm finding, again, the cause of the problem. And if you go to our video we did on nutrition and metabolic treatment, we talk about that there, where we're trying to get the actual cause of the problem, not mask symptoms, not do some fluff and buff to make him feel better. We want him better. We want his condition resolved. So far on the left side of the body, we don't have a lot of restriction with the hip. Let's try this side. Bring your knee up. What happens on this side?
It's fine.
Good?
Yeah.
No problem with the hip? Okay. Now, I'm going to pull your leg up, and you push it down into the table. This is a hamstring test, and he indicated his hamstrings were really tight. And this is a test to see if the hip sockets are jammed, and that looks really good as well. And now we want to check another component of the pelvis, and that's the pubic arch, or the joint in the front of the body. So I'm going to pull your legs apart, Chris, and you hold them together. Hold tight. Try this side over here. Good. And that looks good too. So far we've tested the hip sockets, we've checked the pubic arch, and now we're going to see if the whole pelvis is tipped forward. So if you grab the table for support there, I'm going to have your legs over this way. Don't let me pull your body straight. Good. Now try over here. Hold. Okay. So that was a little difficult to do.
Yeah.
So try it again. Don't let me pull. So he has a very difficult time holding his body in a C position. And that's the result of the quadratus lumborum muscle in the back next to the spine. Those huge big muscles you see, they look like giant cables coming down there, which probably is maybe where his discomfort is. This is where you have your discomfort?
Yeah.
Okay, so if we want to test the low back, we can use a technique called therapy localization, where we just add stimulus to the low back and see if we get any weakness of a muscle. This is quite accurate. So hold the leg out here and don't let me push in. Good. Now try this side. Hold. Good. Now take your fingertips and go under your back where you have the discomfort and just push your fingertips or your thumbs or your hands up into that area.
Okay.
And throw a stimulus into there and let's see what happens. Hold the leg out. Good. Hold the leg out here. Good. So he stays strong on that. He does not go weak. That's a good indicator that we're kind of looking more at the pelvis here to see if the pelvis is the actual cause of his low back pain, and it kind of looks that way. It looks that way to me for two reasons. We've kind of ruled things out using the range of motion studies. We've done muscle testing and range of motion studies on most of his pelvis, and we don't find that to be a primary area of concern. So we're going to treat this right pelvis, and I'm going to do that right now for you to show you how this works. So bring your knees up and put your feet right on the table. And this is, we talked about painless chiropractic. We're going to use a little portable drop board. We're going to slide it right underneath his pelvis here. Good job, you must have done this before.
Yes.
Seems like you're with the program here. So, this drop board is a wonderful little invention. It has a cocking mechanism in it, and it's going to drop the pelvis back into place for us. So we're just going to cock it up, and it's going to make a little noise here. Going to make a little click noise as it drops. And I'm just going to get on the top of the pelvis here where everybody has that big knobby bone. And I'm going to get right there and push it back. So this pelvis is dropped forward in this direction. I'm just going to push it back that way. And I just want to make sure it's going to stay there. So I'm going to give it a couple adjustments like this. This is very easy to do, and the drop piece really affords us to do this without pain. No pain?
Correct, no pain.
Excellent. Okay, let me pull the board back out. Okay, let's see how we did. So we set the board over here. Have your legs straight out. Good. Now, have your legs over this way. This was the way you had no problem doing. Hold. You're strong there. Now let's go back to the weak side. Don't let me pull. Okay, so we've just made a little correction, and I have a feeling that as the day goes on here today, his low back's going to start easing up nicely, and we'll have him come back next Wednesday, and we're going to take another look at see how he does and give it a few days for this all to settle in, and we'll see what's left. That's how easy it can be. Find the cause, treat the cause, and all else follows. It doesn't always happen that the problem is at the point of pain. This is a very important concept that you have to know. It's very important because if you treat the pain and that's all you treat is the pain point, you could be significantly lost with that patient. It's very important to do a good exam, and in this case, simple stuff. So there's a lot more to this with him. I'm sure his cervical spine has a great deal to do with his low back as well, because that's a primary area of concern, particularly with the low back. When doctors look at the pain in the low back and they don't look around the body, how are they going to determine if there's other areas of primary restrictions that need to be treated? I always do a good physical exam on every patient, every visit. I want to get it all. So we're going to spend another 10 minutes here looking through the rest of the spine and the extremities as well, including the feet and ankles. So we want him to walk out of here today knowing, hey, I feel better. I think he's got a handle on my case, and there's hope for me. So there's always hope. So thank you for watching. Again, my name is Dr. James Perkins. I'm a chiropractor and a naturopath. Please call me at 248-855-8707. Or stop by and see us. Go on our website, My-Alternative Health Solutions. And I hope to see you soon. Thank you.